6.4 million American children have been diagnosed with ADHD. 11% of all children are now affected. 2/3 of all children diagnosed are taking medication, yet 65% still experience full-blown symptoms. So the question is, are you playing Russian roulette with your child's brain? Dr. Yannick Pauli joins us now to explain more. Doctor, how are you today?
It's a great day to figure out whether you're playing Russian roulette with your child's brain.
And 6.4 million children, that is a huge number, doctor.
Absolutely, and what I want you to realize, Zach, I'm here so that your viewers are not in the same situation as Johan's parents. Johan was a 9-year-old boy diagnosed with ADHD, and after 2 minutes in my office, he was just out of his chair, bouncing off, even pulling posters off the wall. He was uncontrollable. His dad was yelling, his mother was crying, and yet he had been taking medication for 2 years. Ritalin, one anti-anxiety medication, one antipsychotic medication, and they were going nowhere. And can you imagine what it is for parents to have your child on 3 meds and not getting better? And the problem was that the doctor were just treating the symptoms, one more symptoms, one more drug. So we found the cause. We did a few simple interventions, I'll share in a minute, and within 5 weeks, he was off the meds and living a normal life.
And because I grew up one of the original Ritalin children, having taken it from a very young age, and why is it important to treat what's going on as opposed to just medicating and kind of covering up the symptoms?
Or if you're covering up the symptoms, it's actually dangerous because some of the things that are causing ADHD can be really dangerous if left in the body in the long term. I've worked with more than 1,000 ADHD children, read more than 30,000 scientific studies on the topic, and there's a lot of causes to ADHD, but in my office I have found 3 that come over and over and over again. So I want to share them with your viewers this morning because they're actually hiding in their house. And if their children are exposed to those, well, they are playing Russian roulette with their brain. So
you're saying that there are things in my house right now that could be contributing to my child's ADHD?
Totally.
Wow.
And that's what I'm going to share. So the first one that we have, which I call the Jamie Oliver ordeal. And that's child's most favorite food in the world. Can you guess what it is?
It's going to be the mac and cheese right
here.
The
mac and cheese.
Yeah.
Now, I can hear parents saying, what? Are you telling me that, giving mac and cheese to my kids is causing his ADHD? And the answer is yes, it can. Because mac and cheese contain gluten and casein, which are 2 food allergens that can trigger ADHD symptoms. And Jamie Oliver knows too well that eating healthy helps him manage his ADHD. Now, there's some fascinating studies out of Netherlands that show that 64% of kids with ADHD have actually food-induced ADHD, and that their ADHD behavior can decrease by 80% in just 5 weeks if you remove the food intolerance. So if your child has ADHD, you need to put them on a diagnostic elimination diet, and the first thing that needs to go is mac and cheese.
Because
that's gone.
I don't think I ever would have thought of that. That would have been something that would have never crossed my mind. It's something as common for children, doctor, as mac and cheese.
It is, and there's more to it. The second one is which I call the Lindsay Lohan lament. When you take antibiotics, such as Bactrim, or even simple anti-inflammatories, such as Advil, it wipes out your gut balance, and that can trigger ADHD symptoms. And we're in a culture where we kind of pop these pills without thinking about it. But when you do that, that can be also a trigger for ADHD. And I called it the Lindsay Lohan lament. Why? Because it's not only ADHD in those kids that happens. Usually you have a lot of emotional instability, those sugar and sweet cravings, and increased risk of addiction. So if your kid has ADHD and has been taking antibiotics or NSAIDs, you want to find a functional medicine doctor to help fix the gut so that your child doesn't end up like Lindsay Lohan, right? We don't want that.
We don't want, no, we certainly do not want that. So,
absolutely not.
So doctor, what you're telling me is that I could be giving something to my child that I think is helping but is actually hurting them.
Absolutely. And there's even more to that because there's some other things that's happening. And one of the other one is what I call the Will Smith syndrome. Will Smith grew up in Germantown in Philadelphia and right next to a factory that was leaking lead. And lead is toxic. So lead can leak from pipes, paints, or other sources, and it's a potent brain toxin. No safe level in the body, and it's been shown to cause 15% of all the cases of ADHD. So if your child has ADHD, you want to ask your doctor to do a blood test for lead also.
As things are in life, awareness is so important. So, doctor, now that we've identified the problem, how do we solve it?
Well, I have a specific formula. It's conveniently called the ADHD formula, and that will help parents get proper diagnosis and treatment. So A stands for assess comprehensively. ADHD is a recipe list of symptoms, and it's not enough to just check them off and give a drug. You need to find a doctor that will look at the cause, and don't let anyone tell you that it's just a brain chemical imbalance in your child's brain.
Here, take this.
There are more to it, exactly. Find a doctor that will play detective and look for the cause. Then D is for drill the brain. Now, we know today that ADHD is related to developmental delay in the right hemisphere. So we need to give drill exercise to your child to be able to stimulate and retrain the brain. Then we have H, which is for harmonize. Harmonize the child's body, harmonize the environment. There are more than 125 causes of ADHD. We need to find them out, balance them so that your kid can heal. And then finally, D is dignify. You know, too often these children, they are labeled as deficient or disordered, and they're not. They're just different. They're great kids. They have their talents, their gifts. We need to help them find out, tap into those gifts, and help them bring it into the world.
So, doctor, to wrap it up, it's all about awareness, identification, and then properly handling the problem as opposed to just medicating and coding over it.
The problem with coding over it and masking the symptoms, it's easy. You know, it takes 2 minutes to the doctor, check off the list, give the med, that's over. We want to really go at the root cause of the problem so that we can get those kids to have normal lives.
Dr. Yannick Pauli, thank you so much for your time today. Really appreciate it.
Great to have me.
Are you playing Russian roulette with your child's ADHD brain? Take the free online quiz by heading to ADHDfreelife.com, or you can call toll-free 1-800-827-1426. Again, that's ADHDfreelife.com and 1-800-827-1426. Coming up on the Morning Blend, we'll get the lowdown on all things silver screen. Plus, it's a common symptom that affects the 21st chromosome. We'll talk to Southern Arizona Supportive Network right after this.